My name is Ulrike Schmidt. I'm Professor of Eating Disorders at King's College London and a consultant psychiatrist in the Eating Disorders unit at the South London and Maudsley NHS Foundation Trust. I have a particular interest in developing novel treatments for eating disorders, and I will talk a bit about a promising line of research that we are doing on non-invasive brain stimulation. So we are very keen in our research group to find better treatments for those people who have developed a more persistent eating disorder, where our usual first-line psychological therapies haven't worked, where perhaps the person has had 1, 2, 3 of these treatments over time and they're still struggling, or where young people have had intensive treatment, perhaps as an inpatient, plus some psychotherapy, and they're still struggling. So we are really keen to learn more about how we can help people who are in that situation. So with that in mind, we're very interested in brain-targeted interventions. We have learned a lot about the impact on the brain of eating disorders through neuroimaging and neurocognitive research. And so what is very clear is that across the eating disorders, brain circuits to do with self-regulation, how we regulate what we eat, how we regulate our emotions, how we regulate our lives in general, are involved in eating disorders, and also brain circuits to do with what we find rewarding. And there is often a bit of an imbalance between these two. What we also know is that over time, habit-related brain circuits become very involved when you have an eating disorder, suggesting that over time, eating disorders become like a really bad habit that is hard to shake off. So we are using increasingly in our research studies a new form of treatment called non-invasive brain stimulation. This has been widely used in the treatment of depression. It's safe and is effective in people with often persistent depression, and we are now using in clinical trials these types of interventions in anorexia nervosa and in bulimic eating disorders. There are 2 different types of non-invasive brain stimulation. One is called transcranial magnetic stimulation, where you have an electromagnetic coil which you hold to the head, which then induces a small current in outer areas of the brain. We stimulate the dorsolateral prefrontal cortex. That's the brain area that's involved in how we regulate ourselves. So again, regulating emotions and regulating what we eat. And we have done a very encouraging trial in people with very persistent anorexia nervosa, 14 years illness duration on average, showing that this kind of treatment, given over 20 sessions, led to people feeling much better in themselves, less anxious, feeling happier, and gradually getting more relaxed in their decisions around eating and food, choosing more nutritious foods rather than always going for the least calorific foods they could find, and then over time gradually also returning to a healthier weight. So this has been a world first study, very encouraging, and we're now doing a similar study specifically in young people with persistent anorexia, using a more advanced form of transcranial magnetic stimulation called theta burst stimulation. This is the RAISE trial, and we're currently recruiting for this. The other non-invasive brain stimulation method that we've been using is called transcranial direct current stimulation, or tDCS, where you induce a small surface current, just feels like a bit of tingling on your skull, in the brain. And the beauty of using this is that you can do other interventions in parallel. And we have done this in binge eating disorder in parallel to cognitive training, where we got people to divert their attention away from highly sugary, highly calorific foods like cream cakes and the like, which often trip up people with binge eating disorder. And what we found is that the combination of getting the brain to be actively involved in doing something that's helpful, like averting your attention from the cream cakes, together with the brain stimulation, that leads to reductions in binging, the weight stabilizing, going down a bit, mood improving, and much more so than if you give a sham stimulation or if you just give the cognitive training alone. So we're trying to build on these findings and do more trials, because this is all at the research level, but we're really excited that those brain-targeted treatments might be really important additions to our usual psychotherapies in future, and give people who have been left behind because they've tried everything that we have to offer to them, give these people new hope for recovery. If you are interested in any of our work on these non-invasive brain stimulation trials, do please check out our Center for Research in Eating and Weight Disorders website here at King's. We also have a special website for early intervention and for young people with eating disorders. It's edifyresearch.co.uk. And check out both of these where we have information about these trials.